Heart anatomy. We have developed this video to provide you more information on the heart. Let's discuss how the heart works, coronary circulation, and heart anatomy. About the size of your fist, the human heart is one of the most important muscles in the body. It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of 4 major chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs, where it becomes reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back to the rest of the body through a complex network of arteries, arterioles, and capillaries. While the blood is circulating through the body, it delivers oxygen and nutrition to tissue through the capillaries and at the same time picks up carbon dioxide and other waste materials. The vein returns the deoxygenated blood to the right atrium and the cycle begins again. The heart has 4 valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood flow through the valve and close to prevent blood from flowing backward. The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side between the right atrium and the right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side between the left atrium and left ventricle, and the aortic valve separates the left ventricle from the aorta. Heart circulation. As blood circulates through the heart, some of the blood flows into a set of much smaller blood vessels that provide blood directly to the heart. These arteries, called coronary arteries, surround or crown the heart. This separate circulatory system, called coronary circulation, keeps the heart nourished and oxygenated. The 2 main branches of the aorta that nourish the heart are the right and the left main coronary arteries. Coronary artery disease, which occurs when there is a built-up of cluster of plaque, affects the arteries of this circulatory system and causes a decrease in the blood flow to the heart muscle, resulting in a possible damage to the heart or a heart attack. The beating of the heart, which is its rhythm, is regulated by electrical impulses generated by your heart muscle. These impulses begin in a sinoatrial node and cause your heart to contract. Sometimes the sinoatrial node is also referred to as your heart's natural pacemaker, since it keeps the heart rate constant and consistent. Impulses then travel to the atrioventricular node, where the signal is checked and then sent through the ventricles, which causes them to contract. Your heart rate can change based upon external conditions such as diet, exercise, stress, and even hormonal factors. Thank you for viewing this video on the human heart. This video is developed to provide information about the heart. This is not a substitute for a medical advice. If you have questions about the heart, please talk to your physician.